Hey everybody, Dr. Farley here, back for part 2 of the diabetes videos. So we're going to talk about type 2 diabetes. So again, if you remember from the first video, that is a type of insulin resistance where your cells have stopped responding appropriately when insulin is made from your pancreas. So this type of diabetes develops over time from too much exposure to sugar. And this is sugar that is found in things like obvious sources of sugar, sodas, Starbucks drinks, Sonic drinks, sweet tea, candy, desserts. But sugar is also broken down in simple carbohydrates. So those are going to be our things like breads and pastas that will also be processed into sugar and cause an increased insulin amount production from the pancreas as well. So over time, that overexposure to your cells from increased insulin production of the pancreas, you can develop type 2 diabetes. So it is environmental, but there also is a large genetic component. You are more likely to develop it if you have a family member who develops it, or if you're a female and you have a history of diabetes during pregnancy. So this is typically tested for when you go in for your annual labs. But if you have symptoms of type 2 diabetes, it's usually increased thirst and increased urination, sometimes some numbness and tingling, and overall you may just feel fatigued and not really well. But we can see type 2 diabetes on a simple blood sugar test done on your finger. Diabetes is considered when a non-fasting glucose is over 200 or a fasting glucose is over 126. There is something called pre-diabetes as well, which is where we're starting to see that trend towards insulin resistance, but we're not complete insulin resistance yet, and that is going to depend on a blood sugar between 100 and 126 for fasting. So that is kind of a type 2 diabetes in a nutshell. There are some great medications for type 2 diabetes that can improve the metabolic system and also result in weight loss. Type 2 diabetes, when it is early stages and caught early, can usually be treated with lifestyle intervention as well and changing your diet and the way that you exercise. So stay tuned a little bit more because we are going to talk about the components of a healthy lifestyle in our next video.